Good evening, ladies and gentlemen, and welcome to yet another amazing topic. I remain my humble self, Lucky, Dr. Drugs, and it's with pleasure that I am the host for tonight's seminar. Tonight we'll be talking about something that is affecting people worldwide. We keep talking about this thing, and it seems to be getting worse. We need to find out how is it possible to treat this condition called autism. Autism is actually related to a lot of other intellectual disabilities, but I often use autism as in the center when I'm talking about other intellectual disabilities because it seems to be so rampant these days. Well, without much ado, our topic is autism treatment, do's and don'ts. I remember my humble self, Dr. Drugs, and our table of content goes thus. We're going to talk about autism and ADHD. The reason why we're talking about this is because they move together. So I just added ADHD as an extra. Oftentimes, children that have autism have ADHD. Some parents do not even know whether their child is autistic. And we're going to talk briefly about one of the greatest challenges we're having. And the people I'm going to mention, surprisingly, the people responsible for that challenge we're having. Believe it or not, you may be shocked. We're going to talk about the different types, the signs, the risk factors, because we're talking about do's and don'ts. So when we're talking about risk factors, we're talking about don'ts indirectly. We want to go into management. We're talking about do's. You see the way we're going to go about this? So please take note. Then we'll talk about natural pharmaceuticals because we know that chemicals are often contraindicated in children that have autism. Let's not forget that people are wondering why their children are having autism after a very serious fever attack or having seizures after fever. Why is it that a lot of children that taking fluoride act this way, aluminum salts, why are they acting that way? Why are solvents causing this for mothers and all that have special children and so on as well? We'll talk about all those in a nutshell. Then we'll move down to management, where we're talking about how to improve neural connectivity, which is the key factor in treatment of autism. Then we'll move to something also important, that is applied behavioral analysis. Then brain nourishment. Of course, we're talking about the organ that is called, we're talking about the brain, which is a very important organ in regards to this topic we're discussing. Then, of course, diet, do's and don'ts, and natural pharmaceuticals. Well, briefly, autism is simply a neurodevelopmental disorder that affects communication, social interaction, and behavior. Bear in mind that it is a silent epidemic, and of course, different children are affected differently. So that is why sometimes diagnosis could be a bit difficult. But anyone that knows what he's doing should be able to give a very apt diagnosis quickly. Okay? And different people respond to different stressors or ambient conditions differently. Then we also know that oftentimes these behavioral differences are set or marked or characterized based on the ambient accepted norms in the society, the stressors, and the responsiveness to stressors. Of course, that makes us understand that these children should not be taken as people to be cured, but accommodated with love in the society. We have different types. We have the classic autism, which is often terrible. We have the Rett syndrome that affects females mostly. And of course, Asperger's syndrome is a milder form. You find out that a lot of children have Asperger's syndrome. But, well, the society just say it's rascally, it's restless, it's noisy. We just classify an adjective. But actually, that's autism in disguise, but a milder form of autism. Then we have childhood disintegrative disorder or HELA syndrome. Of course, we have pervasive developmental disorder, non otherwise specified, which is also under milder form of autism. So, but let's bear in mind that there are different levels of autism as well. Talk about that shortly. Difficulty with social interaction is one of the signs of autism. Verbal and non-verbal communication issues. You find out that sometimes a child that is supposed to come and tell you, "Mommy, I want to drink water," the child will carry and start traveling to the fridge. If he wants to do anything, can't say, they keep pointing and pulling and shoving and getting frustrated and throwing tantrums. That's because there's verbal and non-verbal communication issues. Then we have perseverative interest, resistance to change, okay, or repetition. Of course, repetition of a particular response, such as a word, phrase, or gesture, regardless of the absence or cessation of a stimulus. I have a patient, or I have a special child that we keep asking, "Daddy, are you a man?" you answer today. Tomorrow, you ask you 5 times. Next week, we ask you 7 times, over and over again. It's a terrible, terrible, terrible condition. We thank God that the person is, the special child is already okay and is going to normal school and everything. But that's just to give us an idea of how this thing can happen. It only takes someone that is trained in this field to understand or spot that that is a sign of autism. But somebody that is not trained or someone that does not understand may begin to get angry and begin to beat the child and say, what kind of nonsense? I answered you yesterday and all. But actually, there's a point you interact with the child and say, but you asked me this question yesterday, and what was my response? If you have hit the jackpot, the child will say, you said that you were a man, and then you may be surprised, you may never ask again. So that's how we act with. And then when he does that, when the child does that, you reward the child and encourage the child to limit the way he asks questions repeatedly. And by doing so, you are applying what is called applied behavioral analysis indirectly. We'll talk about that shortly. So I'm just giving us just an example of how we managed to resolve a challenge like that not too long ago. Now, stereotypic body movement, then rigid routines, resistant to change. The child likes watching 304 DreamWorks. You dare change it, or the child watches Coco Melon every time and you change the station, can scatter the whole living room, or the child is always handling the phone and you come and take it from the child. Problem, throwing tantrums and all that. And of course, over or under sensitive to sensory input. Some of them, if you just put on lights like this, they're just like vampires. Some of them, they'll just come to the living room, they put on all the lights in your house, will come on, even the one outside, for no reason. So they are over or under sensitive. Sometimes when you are busy talking quietly, you find that the child begins to cover your voice is like thunder in the child's ear. Sometimes you'll be shouting and the child will never answer you. You can see that. Of course, restricted interest is not left out. So these are the risk factors. Older parents, certain medications that are prescribed, prenatal issues, perinatal and neonatal. We're talking about things that happen before pregnancy, during pregnancy, or after birth. You see that some women smoke, drink, or happy. They don't take their antenatal hematinics. They don't take any of those things, and they are always taking unhealthy food. They don't go under the sun for the sun to touch them, to give them sunshine vitamin D3, 125 dihydrocholecalciferol. They don't take it during pregnancy. I'm talking about during pregnancy. Then before pregnancy, they have a lot of poor lifestyle choices, and then after birth, some women are careless. They don't breastfeed exclusively or the way they're supposed to. Imagine a woman giving a child water at the wrong time and things like that. These things can affect, you see. Environmental factors like air pollution, shock, hostility, and all that. We talk about parents that are undergoing divorce, stressing the children emotionally. Many of the children that come to me with this situation, many of the special children are coming from homes where the father and the mother are no longer together. I don't know what's happening. It's like one way or the other, if you pay close attention, you find out that these children are actually geniuses that are trapped in their bodies oftentimes. So when the parents think that they don't understand what's going on, it's like they understand. They understand what's happening. They know that daddy and mommy are not together. And that thing is actually breaking them and making the situation worse. So please, parents, let's try to see how to make things work so that things will work for us. Now, preterm birth, giving birth to a child before EDD, expected delivery date. Then we have genetics. It often moves with men. Sometimes you see some men, they will be treating the woman as if she's the one that gave the child autism. Well, ladies and gentlemen in the Lord, let me just give us this information. You can go and verify this autism of a teen moves mostly through men, not women. Go and check the population of people that are autistic. You find out that a lot of them are boys. So tell me, who do you think carries the gene of autism more? So men, please take the responsibility on your head, because it is most likely you that gave that child autism. Then we have poor brain development. That we're talking about, that's in terms of genetic aspect. Then we have poor brain development, small birth weight, delayed delivery. Many times I ask some mothers, did you have any birth complication? They say they don't really have, but they stayed very long when they were in labor. You see that. Then malnourishment, I talked about that recently. Some women don't even touch their antenatal medication. Say, I don't like drinking drugs. I don't like, you don't like drinking drugs, but now you have a child that's autistic and you're complaining. Why don't you take those antenatal medication to be sure that the vitamin D, the folic acid, and other important things that will most likely be there will help this child mold the brain the way it's supposed to be molded. Now, this information you are seeing here is an old information where we were even saying that it occurs in 1 in 100 people worldwide. My brother and sister in the Lord, believe it or not, there was a time I wanted to give a seminar, they were like, it's 1 in 150 in one country. I'm like 1 in 150. I was about to adjust. Then on that second, I was hearing 1 in 30. I'm like, what was going on? This is between last year and this year. When I went to give a seminar in Ikeja the other day, I was opportune to be with some dignitaries, with two dignitaries. And one of them happened to be a very senior therapist, very powerful therapist. When I was telling her about how it was getting worse, and I think it's now about 1 in 30, say 1 in 30, that 4 out of 10 children are having the possibility of being autistic now. So if somebody gives birth to 10 children, 4 out of those 10 on average have a tendency of being autistic now, one way or the other. So what are we talking about here? In fact, it's a silent epidemic. And it's very sad that many governments, especially in this part of the world, when you talk about autism, they carry earpiece and play loud music, they wear thick sunshade, so they don't even care about it. And that's why it's getting so bad now. Its onset is in early childhood, and the complications range all the way from educational to learning issues, down to bullying. All right? These are the 3 levels based on independence and how much support is needed. Okay? That's level 1, 2, or 3. With level 3 being the worst. I heard of a woman that her child did not even know whether he is an animal or a place or a thing. Just the child is just there. Autism that's the worst level of autism. The woman sent a message to me, a voice note to me, thanking me that her own celebration is that her child now knows that he's a boy. When some people are complaining that their children are not engaging in conversation and they don't allow me to sleep, somebody was celebrating that she applied the rules I gave her and followed what I told her to do for 2 weeks, and the child now realized that he's a boy, and she was thanking God. This condition is a terrible thing, honestly. Now, in terms of management, of course, let's bear in mind that mostly we're talking about do's. The mother is the first doctor after God. Please don't believe in, we that were health practitioners, your children just come and stay with us for 1 or 2 hours, max, or possibly. Then you're given an appointment for 3 months. Then if Prof did not come back in that 3 months, he went on vacation, they postponed on that 3 months again, and time is going. You as a mother, bear in mind that you are superior to that professor of neuroscience or whatever, because you are the one that knows that child best. It's not better you go and learn about this condition so that you can begin to know what to do. Don't depend on a health practitioner that all his children are talking and interacting, or even abroad and enjoying themselves. And you think that they care about you that much? If they care about you that much, they'll come and live in your house with you and your child. You are the one that is supposed to learn these things because you are the first doctor after God. That's why I hold these seminars to educate women, because I believe that educating mothers or special mothers and trying fathers or special fathers is one of the major ways we can help to curb this thing. Honestly, because these children are with us in our homes and they don't live in the hospital. So let's bear that in mind. Then, of course, improving neural connections and neuroplasticity. That's improving neural connectivity and neuroplasticity. Once you don't improve neural connectivity and neuroplasticity, most of the other things that you are doing you're just wasting your time, most likely. Don't waste your time. Because the child cannot learn anything. That is it. The only way the child can learn is by improving neural connectivity or neuroplasticity. The nerves have to improve and connect with each other and interact with each other in the brain The Broca's area, if it has a problem, no speech. The temporal lobe has a problem, interaction and behavior, and some other things, gone. If the hippocampus is having issue, cannot remember anything. You understand? That's just how it is. Different parts of the brain control different things. And that's why you see that it's a neurodevelopmental disorder. Neuro, nerve, developmental, development. From the definition, we should know where we should face first. Some of us are spending a lot of money on therapies. It's good. Therapy is good. We're not saying that therapy is not good. What we are saying here is that in as much as you are doing that, bear in mind that where, in quotes, you are therapying to has to be prepared. If not, that child cannot learn anything. Some will say that they tried and tried and tried, they are tired. Tried what? You're running around in a circle and you're trying. The child is not improving. You have been paying 250,000 per month for a therapist for the past 4 years, and the child is still looking at you, is not improving. Don't you think that there's something else you are supposed to do? Let me give you a suggestion. Go and improve neural connectivity and neuroplasticity. I'm going to teach us how we're going to do that today. Now, so of course, we have management apart from the use of chemical drugs. These chemical drugs have side effects. Unfortunately, in some cases where the children are having convulsion and having some other issues, you see prescriptions like risperidone, epilim, and all those kind of things. Well, many of these practitioners are stuck between the devil and the deep blue sea. If we had a choice, we wouldn't have given those things. But there are other ways we can actually help to mitigate these issues. And we're going to talk about that as well. Now, avoiding risk factors and all that, that's apart from the use of chemical drugs, we can actually have early management via applied behavioral analysis. You see, therapists are heroes, you understand? But they need a platform to perform. And that platform or canvas that they need to do their work or do their artwork to make the child better is on the nerves and the way they interact with each other. That's neuroplasticity and neural connectivity. That is it. So many therapists that come around to me, when they listen to me, they start saying, no wonder. No wonder. They say no wonder because there's some of these patients, there's some of these special children that they teach and teach and teach, nothing is entering. I'm like, where will they enter to? And they start looking at me like this. I'm like, yes. And when they go back and begin to apply these things, definitely they will come back and say they're having results. And of course, we have cognitive behavioral therapy. Of course, institutions where we have ADHD. Now, occupational therapy is not left out. Speech and language therapy, dieting is very important. We'll talk about this a lot. You know, long-term use of gluten and casein-free diet or less sugars have been known to help a lot of children for a reason called, they help to prevent what is called leaky gut. Then we have natural pharmaceuticals. This one is so important. This one is so important. We can't do without this one because these are the things that lay the foundation upon which these nerves begin to improve, reconnect, and grow. That is one thing that we need to understand. Okay? Vaccines have no effect on autism on paper. But let's not go beyond that. If you want to know more about this, you can get across to me. I'll tell you some deeper aspect. But on paper, as a practitioners, this is what we'll tell you. But some of us already know certain things. Yeah, these are the comorbidities. Things that come with autism include, seizures, learning disability, anxiety disorder, depression, sensory processing disorder, GIT issues, which is very common. Bear in mind that this GIT issue is very, very serious because the two most important organs that are affected by autism is the brain and the gut. And guess what? Those two organs are connected via what is called the gut-brain axis. So believe it or not, what that child is eating can be helping the child come out of autism or be putting the child into autism more. Then we have sleep disorders and weak bones. These weak bones, as a result of the fact that we have withdrawn milk because it contains casein. Calcium that is found in the milk is also withdrawn. There's somebody that complained that in Abuja, she was the one that sent a testimony to me one time. Guys, if you can remember a woman in Abuja that said that they called her from school and told her that her child was improving. and they did not know how it was happening. She was so excited. She sent me a voice note and even told me that I could share it. So I shared it on the group chat. I think I should share some of those testimonies again, maybe after this seminar. So we hear mothers that are giving testimony that their children are pulling out of autism. You see, but there was a mistake that she made. She withdrew the calcium, the milk, and all that, but she did not give a substitute for calcium. I now reminded her that, have you forgotten I told you, blah, blah, blah. She was like, whoa. And guess what? The child was now the tooth of the child was now getting rotten easily. She just coming to say she doesn't know what's happening, that her child's tooth is getting rotten, that they are all milk teeth. But I said, but milk teeth don't have to get rotten before they fall off. You understand? Then I asked her this question: what are you giving to substitute calcium? She said, and she's not, she now remembered when I told her. So guys, let's take note of that. And of course, some of these children harm themselves. If they have a small injury, they can pinch it until the thing becomes open. And guess what? You cannot apply iodine there. Anything you apply there is traveling to the brain. Just know that. So there's something I'll show us that we can apply shortly. So here are some tips, dietary tips. Avoid casein, avoid gluten. Those that if their food does not taste like the one that they are showing on television, where they are advertising all these poisonous substances, they will not eat it. You understand? Maggi, no, Ajinomoto, all these things are toxic to children that have autism. Period. Those that like drinking Coca-Cola, Fanta, Sprite, Pepsi, when they go to a party, they will drink 4 bottles and say that they will be giving their children drink, their kids, enjoy yourself. Be aware that these things provoke ADHD. Go to Google and go and check. Nobody will put on top of Coca-Cola bottle and say provokes ADHD. Nobody will buy it. So apply wisdom. Chemicals to avoid: number 1, fluoride. Number 2, aluminum. Aluminum is found in those things we apply in our armpit a lot and so many other things. It is a known metal that affects the brain. Just go to Google and check. I will show us some things that will shock us now. Pesticides. Those are like spraying the parlor and the kitchen, and they will carry an autistic child and put inside there. And there's a child that refused to go to school after inhaling the insecticide that the father sprayed in the midnight. It didn't clear before morning. When the child came to the parlor and sat down, he turned to the mother and said, I'm not going to school. A child that loves going to school, a child that was just pulling out of autism, decided that he's not going to school. What happened was that the father did it again. And the child came to the parlor another time again and sat down on the same chair. After some time, turned and said that he's not going to school. Just imagine how fast the pesticide affected that child. They are hypersensitive. What you cannot smell, an autistic child can smell it. What you don't notice, that you just get the food and eat and take it. An autistic child is noticing every single spot in that ogi that I can see it. So be careful. Air pollution is not left out. Heavy metals like mercury, those that take all this makeup too seriously, and you transfer all these metals that they use to support their makeup to these children. That's why we do heavy metal testing in children that have autism, and you find out that some of the metals are high. Especially those that their mothers are always doing makeup to. So you put my baby, you peck, and you're transferring lead and all these things to these children. Please be careful. Phthalates, polycyclic aromatic hydrocarbons, perfluorinated compound, bisphenol, endocrine disrupting chemicals, volatile organic compounds, especially those found in paint. I will shock you guys shortly. Once you know any woman that is working in a paint factory, just know that woman has a 50% chance of giving birth to an autistic child. Period. There's no Dogo Magana there. The woman has a 50% chance of giving birth to an autistic child. I'll show us something shortly. So those that like doing fine and applied art, when they are going out, they will carry their face and go to painter shop and they will spray first coating, second coating, third coating. Be careful. Then, of course, triclosan, that is also found in antibacterial soaps and toothpaste. Please, let's be careful with these things. We have, of course, we talked about aluminum already, and all that. look at so many of them. You can just look at these things and see what these children, they are special children. They can't, accept their bodies, the artificial dyes, red, yellow, red 40, yellow 5, tetrazine and all that. Their bodies react to these things. That's just the way they are, courtesy of us, because we gave them the gene. Now, when choosing creams and lotion, opt for products labeled non-toxic, hypoallergenic, fragrance-free, dye-free, paraben-free, phthalate-free, natural, organic. You see them written at the bottom, at least in some of them. I don't need to talk too much about this matter because so many parents have confirmed that fever worsens autism cases, especially the seizure part. Okay, so that is just it. These are the symptoms of fever, all the way from elevated body temperature above 37 degrees Celsius, sweating, chills, headache, and all that. The picture down here depicts what we're talking about. These are the different causes. Some people say that immunization causes this, and that's why some mothers think that vaccines cause autism, but well, it's not true. It's the fever that most likely provokes it. But this is not true. I'm saying it's on paper, because anytime how science goes, this was how they were talking about Ozempic. I was saying it, that this Ozempic, with common sense alone, should tell you that Ozempic can cause somebody's sugar to crash. Everybody in America, Dr. Dross, how can I get Ozempic? I said, there's no shortcut. You cannot be eating all the food in McDonald's and you want to just take an injection and go scot-free. Now, they are suing the company left, right, and center, according to rumor, because they have now discovered that it causes problem. I don't want to talk about the COVID vaccine, because before people will say I'm saying another thing, but look at what's going on now. Then we have complications. These include seizures, dehydration, electrolyte imbalance, and guess what? Communication difficulties, behavioral changes, agitation, aggression, ADHD. So you see what fever can do. That's why I tell parents, buy the anti-malaria and keep in your house. Don't wait until the child is having high fever. You start running to the hospital. Help. Once the child is already having the signs of malaria, you're always hugging the child, carrying the child, bathing the child and everything, and you can't feel the temperature. Some of us are so careless. That's the problem. We carry housemaid and put everywhere, which is, it's not our fault, because we need to work, I won't lie, I even support use of housemaid so that the stress on mothers will not be too much. But you as a mother, to go and check your child. You as a father, nothing stops you from going to check your child. Now, it's still, but I know you are hard worker and thing. If you have the opportunity, assess the child. You may be the one that will say, this baby's body is getting hot. Because fever causes regression. All the things you suffer to try to imbibe, all the therapies that you have gone to meet, all the things the child is managing to learn and speak, fever can just come and spoil everything. You start again. Now, you see that communication difficulties, oftentimes ASD starts after a high fever in many special children, followed by non-verbal attributes, especially from my own personal observation. You won't find this one on any place, but from the hundreds or thousands of patients that have come my way, between the age of 1 and 2, plus or minus, that's when it strikes a lot of children. Go and check. So maybe we'll still have to do some research on that. Of course, increased risk of respiratory distress is not left out. Please, I don't want to talk much about this. Fluoride is poison. I don't know who began to say fluoride is good for the teeth, good for that. It is pure poison. Anybody that will tell you the truth, I've done some research on this, and I think there was a slide, there was a seminar I had, and I showed people a slide where I screenshot a portion where a research was done, and they confirmed that children that were exposed to fluoride had a higher risk of having autism and lower IQ. Yet, if you watch a Colgate advert here or some of these close-up adverts, you find the way these children are. Nobody is saying that this thing is harmful to special children, because special children seem to be forgotten. In some cases, they are like forgotten children. So when we're talking doing adverts, we just do adverts for other children and just forget them. I don't think that is nice. A warning should be on that contains fluoride and not suitable for special children, children that have autism, dyslexia, blah, blah. It won't kill anybody. It will help these mothers to know. And because guess what? Many of these special children, just put the toothpaste in their mouth, they are swallowing it straight. They are swallowing it. So imagine that we're talking saying that the fluoride that is even getting in contact with the mouth is not good enough. Then imagine the one that is going inside the stomach. If you are not even watchful, if you are not even careful, the child can carry the whole and just start sucking fluoride. Where is it going to? So maybe if I had that something like that, wonderful, is here. Now, you see that, look here, they said the rise in the autism spectrum disease prevalence in countries with water fluoridation as well as in endemic fluorosis areas supports a view that fluoride is an important environmental factor in autism spectrum disorder. This is the conclusion of the experiment that was done. I'm not showing you something that somebody was gisting. I'm showing you an experiment has been done to prove it. So those of you that are saying, where will I get non-fluoride toothpaste? Contact me, I'll give you non-fluoride toothpaste. Or I'll show you where you go and get it. Please. Because it's directly affecting these children. This one is not that someone is gossip or something. It's clear. Now, in terms of solvents, like those ones found in paint and all those things, we keep saying these things, but I can't get tired of saying them. Even till next year, if I'm having a seminar, I will most likely put this here because new people that come need to hear this. A lot of mothers that are exposing themselves to different solvents do not even know that exposure to solvents, chemicals commonly found in paint, adhesive, cleaning agents, and industrial products adversely affects children's neurodevelopment with heightened risk for those with intellectual disabilities such as autism spectrum disorder. I don't know that research that I did, that research work is here, but we'll find out shortly. Now, they even said furthermore, maternal occupational exposure to solvents during pregnancy has been associated with what? Guys, just look at this part of the screen. Let me zoom out so that you see what I'm saying. 50% or more incidence of intellectual disabilities like autism. I spoke about this not too long ago. Okay. Thank you very much. Now, study finds autism in children linked to mothers' exposure to solvents at work. So you can see regular exposure to paint, nail polish, cleaning products, and other solvents on the job could impact whether your child is born with autism or not. This is it. If you want this research work, contact me. I will go and get it for you and send to you so you can go and start reading. Simple and short. But you find that this kind of information, you will not find it outside in the open easily. Because those that are benefiting from all these things will never allow it to come outside like that. That is it. So some women that will paint their nails like Dracula, everything, and you are wondering why you're having children that have autism. Because the solvent is going in there. You understand? You want to show that you use acrylic. You want to show, yes, we pay for all these things as men, but I think if you have the tendency of having a child that has autism, I think you should just go and clean your nails and just leave them. You know, look at this. This one is even growing on its own. I don't even know. So why are you stressing yourself and risking this? Let's see. A study by the National Institute for Occupational Safety and blah, blah, blah. You see? A study by the National Institute for Occupational Safety and Health found that women who are in regular contact with these chemicals at work are 50% more likely to have a child with autism. Let me zoom it out so that you don't say you did not hear. Look at it now. You can screenshot it. 50% more likely to have a child with autism. That is it there. So some of us that are going to all these teaching hospitals, we are taking children and collecting an appointment 3 months, 6 months. if you like, collect all the appointments in this universe, and if you don't take note of these things, you are most likely wasting your time. Because these things can keep pulling the child down while you are trying to raise the child up. So this is just saying, buttressing what we talked about shortly. Okay? So these are among the don't. Aluminium salts. We've talked about that already. And that's why people are suspecting that vaccines, can provoke autism. Because we know that aluminium is a known neurotoxin that can cross the blood-brain barrier. That's the barrier that God used to shield our brain from all the nonsense we used to put inside our system, in quotes, or the things that enter our bodies that are not good for us. So even if it's attacking other areas, the brain, that is one of the chief centers in the body, is protected. Do you understand? But this aluminium salt is notorious to pass through it and damage nerves. You see? And that's why people are suspecting that the aluminium salts that are often used in vaccines can provoke autism. That's why I said vaccines don't provoke autism on paper, because they've not allowed us to. Let me just leave that one. So these are a few things that it does: oxidative stress and so on and so forth. I think they're wonderful. So guys, we're lucky today. Aluminium and other metals may pose a risk to children with autism spectrum disorder. In fact, this one is even a journal of clinical and experimental pharmacology. So those that like spraying those things resonate. Sure, your autistic child is just beside you there. You are spraying it as if you are trying to, you are Elon Musk rocket that is going into Mars. It will be coming all around, and the child is smelling it. Where do you think it's going to? Brain. That's where it's going to. So the things we are hearing today, I can bet you that you may never hear them anywhere. Just know that this is beyond medicine. Technically, it's beyond average medicine. So don't think that your neurologist or pediatric neurosurgeon or pediatric neurologist will tell you. Many of us don't know these things. So I'm currently attending to some doctors' children, some health practitioners' children, virtually in my care. Because the one or two of them open up to me that they don't know anything about it, and they handed their child over to me. So nowhere you're going. Imagine you are carrying your child to the hospital where the person in the hospital is carrying his child on that person. I don't understand though. You see, wahala is like bicycle. So look at it here. So let's not talk too much about that. Now let's talk about other matters briefly. Witchcraft has no business with autism. Your neighbor was angry with you and he threw autism on your child. Is not correct. Denial. Many patients, you see, this causes delay in treatment, making a child lose the opportunity of rapid healing at an earlier age. The earlier, the better. There's a woman that I was consulting the other day, and when she gave me the child's history, and I told her, Madam, don't waste your time. You know that age 6 is a very critical age for children that have autism. Because the basic foundation upon which the neural pathway or nerve pathway of a child is laid down around the age of 6. It becomes more difficult supporting what the Bible says, that bring up a child in a way that it should go, and when it goes older, it will not depart from it, because the system is already laid down. So before the system is laid down and is now already established, you must be able to do all you can to pull that child out. That's the concept. You're talking to some people, they'll be telling you, I reject it in Jesus' name. If my child does not have autism, well, I understand in the power of faith. But they say a problem. I told the woman that a problem known is half solved. I guess you don't want to solve your problem halfway first. And then she began to listen. I told her that time is going. You're living in denial. The child is getting older. Many of these people that you know that are geniuses, that all this, our laptop, our phones, is autistic children that are making it. Many of the components in your phone and is autistic people that have that intelligence and persistence to do those things. Elon Musk is not autistic. Look at, nobody can stop him. He said he must go to Mars, and he's still working on it today. Albert Einstein, and I think whether, or is it Thomas Edison also, I think one of them was autistic. But bear in mind that serial killers, rapists, many of them are also kleptomaniacs. They are just different. They are just autism manifested in different form, because it's all about the resistance to change, perseverance. They cannot change. They take them to prison, they spend time, they come out, they kill again. It's autism. So please, denying it does not send it away. Solve your problem early, if you have. Now, wrong diagnosis is not left out. That one is our fault. Many of our professors don't know about autism. They bring a child, you take a child to the hospital, and you present the case, and it tells you that the child is not autistic. The people, parents go home, and they're still noticing this thing. By the time the child is now clocking 4 or 5, they now go back again. Then another person will now see his autism. You have lost 3 years that you would have used to pull the child out. So I ask some people this question. I ask some people this question. What are you waiting for? A child is not talking when he's supposed to. He doesn't have eye contact. He doesn't interact with the siblings, the parents, nobody. He's throwing tantrums. He's doing all sorts of things. And you're saying, let us wait and see whether it will go. Or your child at home is talking, is interacting. You tell that person's child to wait. Is that not wickedness? Why don't you start treating that child as if he's autistic? What do you have to lose? Why don't you withdraw the things that provoke autism? Do they harm anybody? And see whether the child will pull out. Let's just leave that one, because I wonder how some of us that are practitioners will do our things. The child is, all the symptoms are in front of you. You go for EEG, you go for ABR, auditory brainstem response, you go for this, you go for that. Then at the end of the day, you carry the parents. After 1 year of wasting time, you carry them and hand over to another place again. Wasted their money, wasted their time, and wasted the opportunity for the child to begin his journey of recovery. We've talked about Epsom salts. I gave a story of a woman that went to listen to her neighbor, that since if you put the child inside a bath of Epsom salt, why don't you put it inside the cup so that the child will drink? The Uber rider got the shock of her life. She wake up in the morning, the child will remove his pampers and use the sheets and be doing applied arts all over the wall in the house, then carry the remaining pampers and put on her head before she wakes up. When she contacted me, I showed her the research work that shows that Epsom salt, when ingested, provokes ADHD and diarrhea. That combination is what made the child behave like that. We've talked about vaccines, talked about emotions. Autistic children have emotions. Of course, nothing concerns poor parenting with autism. That child, Koleko, doesn't have training, doesn't concern autism. Igbos will say Azura Azu. It doesn't concern autism. Technology, some will tell you that don't give the child iPad, it's not good. The person that is telling you that thing, he studied medicine when they were using black and white TV. The one they used to open door, that has wooden door that our grandfathers used to have. Do you think that person knows what an iPad can do for a child that has autism? The child is not talking to anybody in the house. The child is not responding to anything. He's not going to school to learn anything. But the only thing the child is interested in is in the iPad. Won't you use wisdom and put all the things you want the child to learn inside that place and make sure the child has no access to other things? You will be shocked that the child will begin to stimulate the broca's area one way or the other. You understand? They have applications that help with speech therapy. Yes. And if you can give the child screen time control religiously, you will benefit what even a speech therapist cannot do for you. Because speech therapists cannot stay with you the way their iPad will stay with that child. So let's apply wisdom and get our facts right. So management is another do's, one of the do's. Management of autism via neural connectivity, okay? Because the human brain is malleable, adaptable, changeable, and all that, we have to take advantage of the fact that the earlier, the better, okay? You can learn via experience. That's why applied behavioral analysis is important. the nourishment, because the materials the nerves need to reconnect and interact with each other. Even the synapses, the gaps between those nerves need materials like acetylcholine is needed. We need cobalamin analogs, folate analogs. These things are needed. Of course, eicosapentaenoic acid, docosahexaenoic acid. These things is a must. Somatic stem cell stimulants, they are all very, very needed. Vitamin D is needed, and so on and so forth. Just a brief about applied behavioral analysis is what we use to increase desired behavior and reduce problem behaviors. This is what we call the 10 commandments of ABBA. But I always like to emphasize on chaining. Don't send an autistic child to go and arrange the room. Because what you will just be hearing is, you just see, if you look at the child's forehead, you can see loading, 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 ping, 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 pong, pong, system shut down, because the task is too much. Break it into pieces. Go and get the bed sheet. Spread it on the bed. Go and get the broom. Sweep like this. Go and get the packer. Pack the dirt. Open the dustbin. You have to do it. Slowly and steadily. One day you go inside the room, the child will lay the bed, get the broom, do and everything. And then that's how the brain will begin to merge. And as the child gets it right, you give what we call positive reinforcement and all that. We have a whole video on ABBA. So we have a whole video on fever and autism. We have a whole video on biomolecules and pharmaceuticals and autism. We have all those things. If you need them, you can just get across to whoever invited you, okay? So ABBA technique is idiosyncratic and tailored to each child uniquely, all right? Now, brain nourishment is super important. We've talked about that already. But this brain-derived neurotrophic factor is also very, very important. And you can see it helps with neural connectivity and neuroplasticity, neuron, that's the nerve survival itself, mood regulation, and of course, low brain-derived neurotrophic factor levels are linked to depression, anxiety, intellectual and cognitive decline, neurodevelopmental disorders like autism and ADHD. So we need to ask ourselves, how do we boost brain-derived neurotrophic factor? Exercise, intermittent fasting. See, some children are so fat like a ball and is having autism. I tell the parents, go and reduce that child's weight. They'll be like, he's a child now. I said, go and reduce that child's weight. It's not helping matters. You understand? Because being obese can provoke inflammation. Remember that the brain in autistic children is often inflamed. The gut is often inflamed. You now come and add fat on top to help inflame the whole system. And you're bringing the child to the hospital to come and manage. Then you go home and take the child to McDonald's to sleep there. No. Go and reduce the child's weight. Mind what the child is eating. He said, if he doesn't eat anything apart from Indomie. So if he only eats poison, you'll be giving him now. You must have to find how to apply behavioral analysis. Okay? Healthy diet, quality sleep, sunlight. So children don't go under the sun. It's understandable because they are under strict surveillance. Parents are like FBI and CIA monitoring these children because some of them, unfortunately, can even wander away. Do you know that a lot of autistic children are got missing? They just stepped out and just wandered away. They don't even know where they are. Some of them probably till today, they've not found them. Sometimes you check in the news, you find a child holding biscuits in police station, and they are saying, where are you from? The child will say, I'm from this so and so place. What's the name of your daddy? Be looking. What's the name of your mommy? Be looking. It happens all the time. Some of them are autistic. So that's why these parents keep them under close watch, and hence, in some cases, they don't experience sunlight. I'm telling you. And that's why I often add vitamin D in the regimen of my special children. And the result has been fantabulous, in quotes. Now, mental stimulation, of course, therapy. These therapists are heroes. They come and paint beautiful things on the canvas, which is the nerves of the brain. The natural pharmaceuticals, super important. We'll talk about that shortly. So without appropriate nourishment and the brain cells developing, nothing enters. It's a waste of time. A few of these biomolecules include eicosapentaenoic acid and docosahexaenoic acid. I don't have a problem with people buying products that they wrote DHA in bold on the packet. But the problem I have is when a parent is buying DHA and it's fake. That's where I have problem. And the parent is expecting magic. Some are looking at the cost. Hey, this one is 10,000. This one is 35,000. And let me buy the one of 10,000. You don't know that you're buying groundnut oil. You're just going home and you tell yourself, I bought DHA and EPA. Won't you go and show your health practitioner to check to know whether that one is fake or original? What is the use giving a child something that is not working? Please, let's apply wisdom. And these are the things you see here that this EPA and DHA can help our children achieve. Choline is unique in the sense that those nerves have gaps in between, and the compound that is in between those gaps is called acetylcholine. And choline is a precursor of that acetylcholine. That's why it's very, very, very important. So please, I give my patients something called, I think, royal jelly. We'll talk about that shortly because it's a precursor choline. But in extreme cases, there's something called Focus. A can of that is about 200,000. I get it from UK. For extreme cases, I give that one instead. Because there are some cases where, imagine you bring a child and the child is just there looking like this. Turn, sit down, not answering anybody. You have to move the child like the way they move mannequin inside fashion, you know, mannequin they use for boutique to wear clothes. That's how you move the children. That kind of case, they don't need wasting time. Just give the child a stronger level of everything, but natural. This sunshine vitamin is taken for granted, vitamin D, but bone health, you can't do without it. You know, we've withdrawn milk because milk contains casein, and I often give my special children alternative for milk. Okay, brain development, mood regulation, neurotransmission, and synaptic plasticity, and so on and so forth. It's just too important. This thing that we give our grandparents. There's a friend of mine that is also a health practitioner. That when I give the child something that contains conjunctive, he said, we normally give it to people that have hypertension. I said, well, my brother, even EP and DHA helps with hypertension, but it's just how God did it. Conjunctive boosts learning because you know that it has effect on the powerhouse of the cells. The powerhouse of the cells is what we call the mitochondria, and it helps it. You know, that's it, mitochondrial function, that's cell powerhouse function. So once you power the nerve cells, then they begin to do exploits. It's as simple as it forward. There's no need to explain this one. When you give the nerve cells what they need, you understand, they improve because you have given it. So learning becomes easier. I don't know whether you guys are following what I'm saying, because you know that the problem is that the children are learning slowly, and then you now go and power the powerhouse of the nerve cells. Learning begins to improve. I witnessed a child that I gave the mother coenzyme Q10, and I told the mother, watch this child. Within 6 months, the boy started writing an exam on his own in school. God and science. In fact, to honestly, what God and science cannot do does not exist. I'm telling you. Aloe vera that people take for granted, used for flower, just look at what it does. It has been used for thousands of years. In fact, sometimes I wonder why we do not emphasize on this aloe vera. That's aloe babensis miller. I'm not talking about all these things people are selling up and down. The real deal. You understand? I'll show us the real deal. Why are we not even focusing on this aloe vera? Because I know that the Egyptians were using it. I know that if you go to the Bible, they kept referring to aloe from the time of maybe Moses or something. I don't even know. But it seems as if we are more interested in tablets and chemicals these days, because these things have been working for our ancestors. And now look at it here. It can help to improve gut health, antioxidant properties, help with immune system support, neuroprotection, behavioral improvement, digestive enzymes, inflammation reduction, oxidative stress reduction, gut-brain axis support, is natural and safe, and guess what? A somatic stem cell stimulant. Remember, we're talking about the brain cells not connecting with each other the way they should. We're talking about it that way. And when you give a somatic stem cell stimulant, those workshops that God put all over our body, anytime there's a damage somewhere, one of those somatic stem cells will change into the cell that is having an issue. So a somatic, and they are found in the brain. So if two nerves are trying to connect and they cannot connect, the somatic stem cell here can change to a nerve, connect this one to this one, and you find out that the child will wake up the next morning and say, "Daddy, good morning." Everybody will start shouting, "Hey, to God be the glory." One somatic stem cell can make the difference. I'm telling you. So when you give a somatic stem cell stimulant to these children, what do you think will happen? Many of them start getting better. These are things that have happened in front of me. I'm not talking about things that I'm guessing or something. If not for patient confidentiality, I can even call the names of children that these things have been useful for. Now, we'll be talking about gut-brain axis. So, but we focus more on the brain. What about the gut, the intestine? We need good bacteria to help the intestine not to be inflamed. I'm talking about leaky guts here. Okay? Now, these leaky guts can allow unwanted materials to seep through the intestine into the bloodstream, and unfortunately, where does it land? The brain. Because the liver may not detoxify everything. Okay? So these probiotics are good bacteria, and they help to reduce the population of bad bacteria that inflame the gut and cause leaky gut. That's why when you give it to these children, the improvement is too much. And when you give good ones, we have the one I give my special children is 8 billion colony forming units per capsule, 8 billion. Whereas many of the probiotics that they sell in all those places, the whole container of that probiotic is not even up to 8 billion colony forming units. But what I give my special children is one capsule, 8 billion colony forming units. So you can see it can help with gut-brain connection, digestive health, reducing anxiety, boost immune system, reducing inflammation, improving sleep, reducing behavioral problems, and so on and so forth. So in terms of diet, a lot of parents will keep asking me, what do we give the child now? You say don't give indomie, don't give bread, don't give spaghetti, don't give biscuit, don't give the, as if we don't know how many of our ancestors were cooking indomie in those days. Let's tell ourselves the truth. Which of us here has a dialect that has a word for autism? Autism is a recent problem, let me tell you the truth. And it's because of all these things we are eating. Our ancestors were not eating these things we are eating. Please, if you know your ancestor had indomie or was cooking indomie, that's your ancestor before white people came was cooking indomie, please put it in the chat room. So what were our ancestors' children eating that made them survive till they gave birth to people that gave birth to people that gave birth to people that gave birth to us? So please, let's stop giving those excuses. It's just because of us are mentally lazy. That's just the truth. We don't want to think out of the box because it's convenient to just pop a pack of indomie and destroy a child's brain with it in little by little. Not all children are affected by indomie like that. But when you have a child that is particularly seriously, and you're still giving the child indomie, and then the monosodium glutamate inside, you now use it to now lace it. That's the gele. You now put on top of the head of the indomie, the thing will now be fine. I agree with you. Now, gluten, casein, artificial additives and preservatives, refined sugars, processed foods, food dyes, and a lot of other things like that are not good for these children. Look at these artificial additives and all that. You see them. You find many of them. Look at monosodium glutamate. Can you see it there? And some different types of things that we will not, let's not talk too much about them. This is what ADHD looks like. And you can see how these additives can provoke ADHD. If you watch Gumball, I don't know, my children, they force me to watch, so I watch almost all the episodes, so many episodes of this. And when I look at this animation, I wish I could just play something from this animation. You now know what ADHD is. This is ADHD. Just go and watch Gumball to know what ADHD is. You know, so these are just the things additives can do. And these are what refined sugars can do. Some parents will say, their children now, they like sweet things. They like sweet things, their children. When they now grow and you're now going for police case every day, God forbid bad thing. There's a man that his child is, I think he's having intellectual disability. The child used to beat him from time to time. Every day, police come and help the man. Every day, every time. He didn't have the opportunity of resolving the problem early. He's now a grown man. So if he now goes to grab another person's daughter, you now start explaining in police station, he's having autism. He's having autism. When somebody's daughter that he has been training in school has been raped and disvirgined by your child, that's if they don't, my brother, you better just find solution early before it gets to that case. These are things I've heard. I'm not talking about things that I may not mention the names of the people, but many of the things I say, I've heard them with my ear like this. Gut health, inflammation, consuming high amount of refined sugars lead to imbalance in gut bacteria, of course, which is already a common issue in autism. Inflammation causes inflammation, blood sugar fluctuation, neurotransmitter imbalance, hyperactivity, that's ADHD. So those that are giving their children Coke and Fanta, they are just giving your child ADHD in a bottle. It's like doing an advert and saying, Mom, ADHD now comes in a sachet, or ADHD now comes in a bottle. You are giving your child ADHD and you are wondering why it's running up and down. You think that the people that are selling Coke will come and tell you that it gives ADHD. I greet you. Now, sleep disturbances, increased cravings, nutrient imbalance, and so on and so forth. So let's try to limit or avoid refined sugars. Let's choose natural sources of sugars like fruits and vegetables. Read the labels, the food labels, and we have to opt for products with minimal added sugars. And then we have to focus on a balanced diet rich in whole nutrient-dense foods. Okay? This is how processed foods cause problem. Artificial additives cause problem, nutrient imbalances, gut health, inflammation, oxidative stress, hormone imbalance, sensitivity and intolerance that can lead to tantrums and all sorts of wahala, limited diets because processed foods limit the amount of nutrients that are going in, behavioral issues, impact on gut-brain axis as well. So people now say, okay, you have condemned all the food in the universe. What do we now give the children? Look at it here. We have leafy greens, we have berries, we have nuts and seeds, fatty fish, sweet potato, avocado, and so on and so forth. Eggs. There are so many. These are just a few. Okay? So please, let's not say we don't know what to give these children because we don't want to. Look, having a special child is like booking a ticket, a first-class ticket in an airplane. It's not the same price as economy or business class. That's just the truth. So once you have a special child, don't be expecting that you will be giving the child the same thing you're giving the other children. You will just frustrate yourself for nothing. It's a special child. You don't, I don't know, Africa, sometimes the way we do our things is different. You are saying, don't I have other children? If the child give birth to himself, you are the one that brought the child here. You must solve that problem and solve it specially. That's how to apply wisdom so that in future you can have rest of mind and enjoy the benefit of your own child that is special. So autism and ADHD are related. That's what we're just talking about here. And they often coexist. Although they are distinct, but they often coexist together. Now, natural pharmaceuticals, I prefer them. Now, I'm going to show us some things I give to my special children. Children that come to me for parents that bring their children to me, and we have been having good results. Please, let's bear in mind that it is not magic. It's not automatic. You want the brain to reconnect, and you give a child some things for 1 month or 2 weeks, and you're expecting the child to fly an aeroplane. Take it easy. A child that has been having issues since the age of 2, you bring the child at the age of 5, then we diagnose the child, we give the child some things to use for in 2 weeks' time. The mother is saying, he's improving. It's just that I need him to do what? Give him your car key now to drive you home. Relax. Let the brain heal gradually. Don't give up. I've watched a child grow out of autism in front of me. Not one, more than one. right in front of me, grow out of autism. And it was not automatic. So please, let's take note. And that's why these natural pharmaceuticals are better, because yes, they may not be as cheap as those chemicals that are given to counter the comorbidities and all that, but they have no side effects. Do you know that one of the side effects of epilim is autism? Go and Google, go and read. One of the side effects is autism. And people are swallowing epilim because their children are having seizures. But what if we can give the child certain biomolecules that can calm those nerves down naturally? Maybe not automatically, to the extent that your own doctor will tell you, I think we should reduce that epilim. Have we not achieved something? So, importance of natural pharmaceuticals in the management of autism, of course, they help provide essential fatty acids for the brain, provide natural neurotransmitters like the choline we talked about, improve nerve function, mitigate gastrointestinal issues, we talked about that as well, relax the brain against insomnia, improve and maintain bone integrity, improve nerve function in the brain and body, then of course, general rejuvenation and regeneration of the body. Okay? Now, what I'm showing us here, I'm not saying that you must use these things, but these are the things I've used for my special children, that children have come to me, and it has worked. The reason why I use Forever Living products, one is an American company that is reliable. They have been here for about 50 years. So some of people are saying, I took this. I don't want to mention some names of some companies that have wasted parents' time, especially Phytobite A, Mentat. Anybody can drink those things. Anybody can drink those things. A lot of parents have wasted their time on those things because you are trying to kill a very big bird with a small stone, and you're wondering what's happening. Do you think autism is only one target? That you think it's something that you can give a bobo niche, one size fits all kind of thing? It's a spectrum. It has so many things that make it what it is. And you now come and give one thing and say, take. Yeah, this thing will make your child speak. Those children that you find in all those adverts, in all those things, who told you that they were autistic before? Because they are smiling and wearing fine school uniform and singing. You go and buy, you are not saying, I've been giving the child Mentat. I've been giving the child Phytobite A for 1.5 years. Then you now say, I have not really noticed any difference. You were giving the child those things because you were trying to fulfill all righteousness, or somebody misled you, or maybe you lack the financial capacity or something. But that may be other reasons, which may be understandable. But bear in mind that not in every case you give the same thing. You want to tell me that you give Phytobite for a child that is having level 3 autism, or level 2, or level 1, or you give the same Phytobite for a child that is having Asperger's, or the same thing for a child that is having pervasive developmental disorder, not otherwise specified, a child that is having childhood disintegrative disorder, the same thing, Rett syndrome, the same thing, right? Oh, so please, let's just quickly take note of this. Guys, get out your pen and paper so you can write down what I'm saying. Because some people will be asking, how did you do it? How did you do this? There was a woman that I showed a child that had autism that I handled, and the child was not talking with the woman. She said, how did you do this? There's no magic there. Get your pen and paper now and listen. Anything you don't understand, you get my contact, and then you can now let me know what you want to know. How do you get them? If you want to know how to get them, if you can't get them on your own, I can help you get them. Many of the children I attend to, I get these things for them myself. So this is kids. It helps with speech. This contains original eicosapentaenoic acid and docosahexaenoic acid in high dose. This contains choline, the one that I said is a precursor of the neurotransmitter in the brain, as called acetylcholine. This contains cobalamin and folate analogs. This contains capsules that contain 8 billion colony-forming units that help with the gut and help support gut-brain axis. This one helps with the gut, gives prebiotics and all that because it contains what we, in fact, I give it to patients that have bile as well. Okay, some of these things you see here, I also give to adults as well, depending on the situation that they have. Okay. This contains chamomile that calms the child's brain down as much as possible. This is a substitute for calcium, but I don't often give special children this calcium, except maybe older special children. I'll show us the one we give younger special children. This contains a somatic stem cell stimulant. So it will help the nerves to what? Begin to generate and grow and mitosize and whatever they're supposed to do to help the Broca's area to connect properly so that the child can start talking, to help the hypothalamus to function well so that unnecessary temperature will not take place, to help the temporal lobe to form so that behavior and other things will be okay, and so on and so forth, to help the hippocampus, the nerves in the hippocampus to act well so that the child will be remembering something, and so on and so forth. This is a very good form of vitamin D. We all know what it does. We've withdrawn casein because and milk, and calcium has also been withdrawn too. So we have to give a substitute. Okay, that is the one I give special children for calcium. That's it down here, NatureMint, because it contains calcium and a lot of other things, and it's so much it doesn't finish quickly. So that the mother will also only 180 tablets in there. So a can like this can last a child 3 to 6 months. It doesn't finish, but there will be constant supply of calcium. This contains coenzyme Q10. That's the powerhouse or the mitochondria of the cells, improves the function of the powerhouse. Okay? That improves mitochondrial function. So people are asking me, where do we get non-fluoride toothpaste? This is a non-fluoride toothpaste. This is a non-fluoride toothpaste. So take note, because you know that fluoride is poison. I've shown us. So not that you see you now go to your dentist now tells you, who told you that? I have shown you the research work. You tell the person that you have personally witnessed. It's not that they told you. So nobody can confuse you. I give this as a substitute for milk because it contains casein. Okay. This one does not contain aluminum salt. In fact, it's for special children. I often add this for their parents. I add it for their parents so they can stop spraying all these aluminum salts that they're spraying up and down and causing confusion everywhere. This is an option for a soap. But I tell parents that if you cannot get this one, go and get Ghana soap now. The one that does not have perfume, it does not have what they call that thing, all those different colors. Just plain Ghana soap is okay. A plain one. That if you can't get this one, if you can get this one, fine. So make the child look, the skin will be amazing and all that. This one is an option for creams. When I mentioned that some of them pinch their injuries and all that, and if you apply iodine there, go straight to the brain. This is what we apply, and the injury disappears fast. You know that these things, some patients that have bile that come to me, I give it to them, and they apply it together with the other things I give them, and they confirm that the bile is disappearing. Believe it or not. These things look very simple, but I know what they contain, and I've used them, and they are working. So let's pay attention. This is another form of a spray that we spray on the skin, especially for injury or blemishes or skin lesions. This is just a variant of the other one I talked about with regards to substitute for milk. Please, let's take notes. Well, it's been a pleasure, and I'll leave us with this. You are what you consume. And there's a constant battle between factors that repair and protect our bodies and those that break it down. Just be on the winning side. Your food may be killing you. Many of the children that are autistic today, is the food that they are giving them that promoted the autism. I did not say caused, promoted the autism. The choices you make today determine how healthy you will be tomorrow. Many of our parents made bad choices that predispose these children to autism. Let's choose wisely. And let's remember to consult with a healthcare professional or registered dietitian to determine the best dietary approach for specific needs. Additionally, consider consulting with a health professional before making significant changes to diet and other things. Okay? And I want to say thank you so much for coming. So on this note, I'll say good night and God bless. Bye.